My name is Dr. Stephen D. Kongulu. I'm the resident veterinarian. I've been working at Ojogi since November 2011. So then, in a normal veterinary setup, when I get a patient, I will start first of all by doing a history. So we always create a database for every dog. So all our dogs have a database. Then as you're collecting your history also, you ask questions whether animal is feeding, is drinking, is passing stool, is urinating. Then you do a systemic checkup that starts with the senses. You can do, you examine the eyes, you examine the mouth, you examine the teeth, you examine the ears. So then all this is external. You examine the animal for external abnormalities, whether there are parasites on the body, whether the animal has got any skin infection. Then you examine the respiratory system, the abdominal system, the nervous system. Here we have various activities, veterinary medical activities that we carry out on our dogs. The major activities are preventative medicine, whereby we administer vaccines to prevent disease. Other activities include biannual health checks. We collect samples with both the attack dogs and the bloodhounds.
The anti-poaching unit in conjunction with the dog section is just like one team, because the dog section will not cooperate, maybe will not work without the anti-poaching unit. Even the anti-poaching unit will not work without the dog section team. We need a lot of training to make this dog section unit being very effective and very running. Now we need them to be to get very daily, even if possible, daily veterinary intervention. Daily for them even to get support of their chews, because at times you see we are just working in a very harsh terrain and hard conditions. For now, perhaps when you go to northern Kenya, there the situation is very hot. The climate is very hot. Even the topography is very thorny, so it's very hard for these dogs just to go. So they need a lot of support. And again, if the dog handlers need a lot of equipment, they need to be equipped fully so that they can operate with these dogs. Again, they need to be trained time at a time so that they can be able to work with these dogs positively towards the anti-poaching unit, so they can be able to assist her to save these rhinos of ours.
For these items I'm holding, maybe it might be amazing, but is more useful to dog. This is camel bag and this is the plate. As you know, we have got blood holes and even assault, and we normally go outside even our county just to make sure our animals are protected, all animals are protected. And we also carry water with this one, because this is easier even for me to carry for my dog when I'm going, because I just put it like this when I'm going for a long distance, because maybe somewhere I'm going inside the bush where the car can't come, yeah, and it will make easier for me and my work. This item I'm carrying here is weighing machine, of which, because we love our dogs and we don't know if they are adding weight or losing weight, so we use this machine.
This is a day sack. The purpose of this one is to carry all dogs' equipment. That is, we put harness in here, we put hard leash. We normally goes with it where the incident is. So we put all our equipment here for the dogs until we go to the place of incident. That's where we remove all the things that are in here. And also we normally put extra food for the dog, because once we go for where the incident is, we don't know how long it will take us to be back. So we put all our food in here, everything concerning the dog, we put it in a day sack.
I pass by the kennels daily, speak to the handlers on a daily basis. Speak to the handlers, ask them the basic questions that the vet will ask. How are the dogs? Are they feeding? How is this day? How is the feeding? Can I see they finish their food, they're drinking. And then I also get to go into the kennels and observe their movements, that they are dull or they're jumping around, they're playing as you will expect of a healthy, normal animal that is free of disease. And for the checkup, the medical checkups, we do once every month. For invasive, as I had said, sometimes twice a year. It is important to keep the dogs healthy because they play a very important role in the conservation program that we run. That important role is the big fight against poaching. So we need to keep them very healthy because they're emergency dogs. Poachers are all over the place. They want to get our rhino, they want to get our elephants, they want to get our wildlife too. So these dogs play a very important role, and when you keep them healthy, anytime there's an emergency, we will always have them out there.
We all Pajeta, we really need help because those dogs, we have got 11 dogs, of which we use them to help even the communities and to keep the safeness of the wild animals. And it is very difficult, and it's very, very, very difficult to maintain those dogs because they have got vaccination of which they have to undergo, and food also.
We need funding to be able to keep up to date with what we do, because then without it, we will not be able to keep the dogs healthy. There are drugs that we use to treat the dogs, antibiotics, anti-tick fever drugs, anti-rickettsial drugs. We also have the laboratory equipment that we use, maintaining the microscope, maintaining the centrifuge, maintaining the stains, buying the stains, buying the salts to make up all those solutions, and then buying other medical equipment, the thermometers, the stethoscope, the bandages, and other topical drugs. Also buying the liquids that we use to clean up surgical instruments. So it's very important that we always have money to take care of these things.